So the study at hand, the one that kind of asked us to talk about, with sort of increased cannabis use in the home, do we think that that'll eventually lead to more issues? And it's always hard to answer something like that that's so theoretical and so individual. But I really do think that if you have more intoxication in the home, be that whatever drug, and if more parents are consuming cannabis in the home, you'll have more intoxication. You're bound to have more developmental trauma. You'll have less attention paid. Whatever it is. I think of my own house growing up, where it was alcohol, not other things, but the kids take a second seat to whatever is driving the parents, whatever they're using to get through. And the family, inevitably, for somebody who's got a use disorder, the family ends up coming second, and the kids really, really feel that. Mm-hmm. So while it might not be the kind of gigantic trauma like, being next to a best friend when they die in a car accident, that developmental trauma of whatever it is, birth to 8 or 9 years old, where there's nothing more important than the stability of your home, it can be a really big deal if there's intoxication in the home.
I think of, I was reading Paul Early's book recently, and he said there are 3 kinds of individuals that become addicted. One is who has the genetic predisposition to it. The second is someone who's self-medicating to deal with the trauma. And the third is someone who grows up in an environment where the culture within the environment normalizes use. And I think, we've treated 1 and 2 more than anything. And I think treatment is geared towards 1 and 2. And I think it's pretty hard when we begin to look at worldview and we begin to look at that kind of shift to, wow, I really have a problem. It's hard to make that shift when everyone around you is doing it as much or in similar ways that you do. And it's hard for families to draw a hard line when the kid is looking at the family like, really?
Well, and when use is that integrated into the family. I tell the story sometimes when I'm giving talks about this. You'll probably remember the patient. It was somebody you and I treated together years and years ago. Well, you treated, I just talked to him before he came in. And he was a professional athlete who was going home for Christmas.
Yes.
And he was really nervous. And I remember Dr. Bader was like, oh yeah, of course, we're all nervous going home for Christmas. And he said, no, you don't know about Cannabis Christmas, where grandma saves up for months and she buys a really huge amount of weed, and then she just keeps it at the house. And so the rolling papers are all at the house, the bongs are at the house, and everybody stops by, and it's what they bond around. So for this guy, cannabis was so intertwined into his family system, and he had a severe cannabis use disorder. Like, how does he go back into that family system that he'll eventually have to reintegrate into, where for them it is not at all considered to be even a potential problem because it's been so normalized, maybe for generations.
And that guy did go home, and he did get a fairly substantial amount of weed for Christmas. And so he had to come back and say, like, it's not just hard, it's almost impossible in that environment. And, families will ask me, like, well, how does this work? And I always say that there are 3 things that can happen when a person gets sober. And when the family decides, we don't need to do anything because we're good, that person has to fit back into that system that has a certain way of dealing with him in a way that he's not anymore. And so he's either going to use to fit in, or he's going to abandon the family and can find other avenues. And I've had clients, families who say, I hate AA, and it took my kid away from me. And I think when we really look at those cases, and this is really hard. We talk to families all the time about like codependency and what, you love your kid, you love your husband, partner, whatever, but that resilient families, number one, come together to identify that the problem is within the family. And he may be the symptom bearer for that. It's classic family therapy. But we play a role in how we maintain the stability of our family. And so, if the whole family gets sober, or not gets sober, but begins to make changes, we see really remarkably different outcomes than when the family decides, we have a new family program, and some of the families are participating and some aren't. And that's fine. We support them and do the things that we need to do. But we're seeing some pretty significant differences for the families that participate and say things like, oh my gosh, I never realized just how traumatized I was through this process. And so, we talk about it as having a one up and one down position. That if the family doesn't need to change, and the other person is always the symptom bearer or the identical client, that it's pretty hard to get sober and then try to interact with families that continue to maintain that one-up position. It doesn't feel like an equal member of